Every Wednesday we have a chat with our exercise physiologist Mark Goswell. And Mark, today we're all about to head off and have an MRI. Now, you want to talk pros and cons of this procedure. Before we do, can you take us through, for those who, I mean, we've all heard of it, right? But if you've never had one or never been in that situation, why do we generally get them, and what are they looking for?
So, look, the MRIs will take an in-depth look at the bones, the ligaments, the discs, the muscles all within the body through a 3D imaging, which gives us some more in-depth information about what's going on in the body if we're trying to investigate somebody's source of their pain.
So a pain sensor, essentially.
We're looking into why. Why somebody got the injury. We've done X-rays, we've done a CT scan, and nothing's really shown up. So the MRI is the next level that lets us see what's going on internally.
Obviously, then we go ahead and go, well, this is what's causing the pain, and we off to fix it land. But are there times where it can give a false reading?
100% of the time. I'm sorry, not 100%. That's pretty big, isn't it? Yeah.
The best negative. We've got is a complete failure.
Complete failure. No. Look, the MRI.
I would also like to point out the opinions of this guest do not necessarily reflect the opinions of this radio station. All right. How effective? What are some things that can go wrong?
MRIs are very effective, but the problem is when we're looking at an MRI, we are stationary. So we're laying down on our back, on our belly, we're not moving, so we're taking out the impact of life in terms of what's going on with us. There are a lot of people that have degenerative changes. Say if we talk about the lower back, if you've got someone in their 50s and 60s who's worked in a labour-intensive job, whether that be gardening, bricklaying, nursing, anything that involves heavy lifting, you are going to see significant degenerative changes within the spine, but they don't necessarily have to constitute to pain. And so sometimes what we can do is we'll get the scan, say somebody's experiencing symptoms further down the leg, so symptoms in the buttocks, in the hips, into the quads, into the knees, and we go and get the scans and we go, oh, you've got all these degenerative changes, that must be the source of the pain. And so I've seen it many times throughout my 20 years of doing this, is that people will get these scans on the spine and they go, yep, 100% that's what's wrong with you. They get the treatment, and 12 months down the track, they're still chasing the answer because the treatment has been fixated on this diagnosis that may not necessarily be the cause of their symptoms.
So how much of a potential, let's say, inconclusive diagnosis can you get by the fact that we're laying and the effects of life are not being presented because we're not standing up? Is there a way of doing that, or is that just too hard to get us in a standing position and have it checked that way?
Yeah, look, they're developing MRIs where you're sitting and standing these days, but their accuracy is a little bit questionable because you obviously have to be dead still when you're in these scans. Look, the thing of it is that if you've got a diagnosis and you're getting the right treatment, the thing to always understand is you should get better after about 8 weeks of treatment. Okay, now maybe not a complete resolution, but if you're not from point A to point B 8 weeks later, you're not making an improvement.
Or at least point 1A. A2 or something.
A2 or A3. Yeah. Essentially, if you're not making that improvement, the practitioner that you're seeing is maybe going down the wrong path and maybe fixated on the results of these scans and not looking at the whole body and not looking at you as a complete entity, factoring in your movement, factoring in your life choices, factoring in what you do on a day-to-day basis in terms of causing that aggravation. So while the scans are fantastic, it's important to make sure that you're getting these assessments on the whole body. And I mean, that's what an exercise physiologist does. We don't diagnose, but we'll go, cool, we've got all this information at hand, but let's have a look at how you move, how you factor that into life, and what are the aggravations that are occurring and why, and does that correlate with your diagnosis? So
essentially, Mark, whoever you're seeing as part of your treatment plan, make sure when they're looking at the bit of paper, they're trying as best as can at that early stage to factor in everything and not just what they're saying.
2NURFM, a broadcast service of the University of Newcastle.